Hello friends, welcome to this e-learning session. We will cover Ascaris lumbricoides in today's session. The objective of today's session are we will discuss general features of Ascaris lumbricoides, its morphology, its life cycle, lab diagnosis, and finally prevention and control. So, what is Ascaris lumbricoid? The common name is roundworm. It is the largest of all intestinal nematodes seen in the human being, and it is most common worm found in human being. The distribution is worldwide, but it is most prevalent throughout tropics and subtropics. If we you can see the distribution of this, you can see that India, Africa, and some parts of South America are the high endemic zone as per WHO graphics. Now move on to morphology of this worm. You can divide morphology in the adult worm as well as in the egg. The adult worm is cylindrical in shape, which is creamy white or pinkish in color. Usually when it is freshly passed, it is pink in color. Then it converts to creamy white in color. The female, the size is around 20 to 35 centimeter, and male is slightly shorter, that is 15 to 30 centimeter. You can see the relative size of female, which is longer, while male, which is shorter and slender. So that should be taken care of. Now if we see egg, egg again can be fertilized, which is the most common morphology you will come across. It may be unfertilized, or sometime if it is long standing, then it may be decorticated. Is oval in shape. It is bile stained, so it will take the color of bile, and so it would look yellow to brownish in color. It would have a thick shell and oval. While if you compare that with unfertilized egg, they don't have the ovum. The size is more elliptical and it is refractile. So you can easily distinguish between fertilized as well as unfertilized egg. Now we come to life cycle, which is the most important thing which we should be understand. Human being is the only host, so there is no intermediate host. Human get infection by mostly through contaminated water and the food, which contains the infective egg. Now, after entry in the human being, first the larva comes out through the egg. Through the duodenum, it would enter into the portal circulation, and through that it reaches the heart. From heart, it would go to lung. In lung, that larva would mature itself, it grows in size, and it would break the alveoli and crawls upward in the respiratory tree. Through the epiglottis, it comes in the esophagus, and it grows in the intestinal tract as an adult worm. Adult worm may be male and the female. After fertilization of these two, it would pass eggs in the stool, and that egg is the diagnostic form. Usually we diagnose this infection by this presence of eggs in the stool. Now it is very easily diagnosed because it is said that one female worm would lay almost more than 2 lakhs eggs per day. So plenty of eggs would be excreted in the stool, and that would contaminate the food and the water. Now that egg need to mature itself, and it has to convert itself into infective form, which is the egg which contains the rhabditiform larva. Now for that it requires almost 14 days. Then it becomes again infectious. So freshly passed egg is not infectious to human being. It needs to mature itself. So that is the life cycle. The things to be remembered in life cycle is human being is the only host, and route of entry of this is infected contaminated food. So it is a basically fecal-oral transmission of the disease. Now we come to the next point, and that is pathogenicity. What are the diseases produced by the this worm? So you can divide this portion into two broad groups. One is the infection caused by the larva, and the other is by the adult worm. So you know that larva is there in the lung and it would break the alveoli. So mainly during that migration it causes the pneumonia like symptom, which is commonly known as Loeffler syndrome, where the main symptoms are low grade fever, cough, and sometimes even blood tint sputum. Now if we see the pathogenicity due to adult worm, you can divide that again into various parts. But if infection is the load of the worm is low, many times it may be asymptomatic. But if load is high, the symptoms would be there, and sometimes it is leading to serious outcome. So if we divide its pathogenicity of adult worm into groups, you can divide it into four broad groups. One is the spoliative effects, or you can say nutritional effects. The second is mechanical effect. Third is toxic or allergic effects. And fourth is ectopic ascariasis. Ectopic means when you will see this worm at unusual sites other than intestine. So that is known as ectopic ascariasis. If we discuss one by one, the spoliative are the nutritional. So this worm would utilize the nutrition of the uh, host, and when the infection is heavy, the host nutrition is suffer a lot. So you will see protein energy malnutrition and vitamin A deficiency. These are the most common symptoms of sorry. So this kind of thing is visible in the child. The second is the mechanical effect. When the worm load is high, it may block the lumen of the intestine. Sometimes it may perforate also. So there may be volvulus, there may be intussusception, or maybe even intestinal obstruction. And if it is an intestinal obstruction, it is uh, a surgical emergency. You need to remove that obstruction, otherwise it may even lead to death. Now in this figure you can see that entire lumen of small intestine is blocked by many worms. Usually intestinal obstruction is common in children below 5 years, because the lumen would be uh, narrower, and that can be blocked by the plenty of worms. Again, this is a photograph which shows the magnitude of this infection, heavy infection. The next is toxic or allergic effect. Basically, if this worm accidentally breaks, it releases a toxin which is known as ascarin, and it is an anaphylactic agent, so may lead to some allergic effect. And fourth effect is, as I have discussed, ectopic ascariasis. The worm is very restless, so it it moves all along with the intestine. Sometimes it goes at unusual site, like uh, it goes in the bile duct. It may come out through the nose or respiratory tract in appendix. So if there is a perforation, if there is a some ulcer is there, it may come out of the intestinal tract and go into the peritoneum. So that is known as ectopic ascariasis. Now we are coming to lab diagnosis. How to diagnose this infection? The It is the most common and easy way is the stool examination. When you do the saline preparation of the stool, you will see plenty of eggs of roundworm, because as I have said that the worm is almost shedding more than 2 lakhs eggs per day per worm. So if infection is heavy, you can see plenty of eggs in the stool, and that can be easily detected. If the worm load is less, you may go for concentration technique, in which we have to concentrate the stool specimen and then we can detect the eggs easily. And sometimes even the adult worm is passed in the stool. So that usually patient tells that in the history. So demonstration of adult worm can also be diagnosed. Sometimes if this is not available, serology and other molecular tests are also available, but most of the time it is diagnosed by stool examination. So that is the most used test for the laboratory diagnosis of Ascaris lumbricoides. Now prevention and control or the treatment. As you know that treatment of ascariasis, it involves various medication. Albendazole is the choice of drug which is given routinely to treat the ascariasis. The most important is the sanitary disposal of feces, because it is a fecal-oral route. So if we can break the chain of this infection, you can save many people from that. The other hygienic habits like cleaning the hands after defecating and before meals would prevent many infectious agents which is having fecal-oral routes of the transmission. In India, deworming, national deworming is also done, which is a mass medication of albendazole is given to all school going children. That is also a way by which we can reduce the burden of such worms. And health education, which is very important. With this, we finish the topic of roundworm. The two very important points are: one is the life cycle and other is the pathogenicity of Ascaris lumbricoides. So you can revise that again, you can refer your textbook, and if any query you can contact the department. Thank you very much. We'll meet again with new topic. Thank you.